From the RSNA, welcome to Radiology Imaging Cancer Journal podcast hosted by Trainee Editorial Board. I am Yashveer Singh from Mayo Clinic, Rochester. We wanted to highlight the ongoing special collection we have. We will be launching the pancreatic hepatobiliary collection. Leslie and Pallavi are leading this collection with support from Dr. Nariman on the interventional side. Today, we are honored to welcome our guest, Dr. Sudhakar Venkatesh from Mayo Clinic. Dr. Venkatesh is a professor of radiology and consultant in abdominal imaging at Mayo Clinic. He is known for his leadership in imaging of chronic liver disease. His work has advanced the use of magnetic resonance elastography for staging liver fibrosis and developing imaging biomarkers for conditions such as MASLD, primary sclerotic cholangitis, and early hepatocellular carcinoma. Dr. Venkatesh is a fellow of Society of Abdominal Radiology, SABI, SIMRM, and ESGAR, and has published more than 320 peer-reviewed articles and contributes to major multi-center research efforts in chronic liver disease. Welcome, Dr. Venkatesh. It's pleasure to have you with us. To begin our conversation, we would love to hear about your journey into the field. What drew you to radiology and how did you become passionate about the liver imaging?
Hello, Yash. Thank you for including me in this podcast. And I would also like to take this opportunity to thank RSNA for asking me to do this podcast. It's an interesting question. It's not been asked for me for a long time, but this is something I decided when I was doing my clinical rotations during medical school. The idea of doing non-invasive diagnosis with radiology really fascinated me because radiology was diagnosing disease without ever having making an incision or injecting anything into the patient. And the fact that you could see inside the body, which we only imagined based on our clinical examination, was just fascinating and incredible to me. So that's why I really got interested into radiology and I wanted to do good imaging. And in fact, good imaging actually helps detecting problems long before even patients feel become symptomatic, and that ability to make a difference early on even before clinical symptoms develop is actually keeping me in this field. Regarding liver imaging, I became more interested during my later part of radiology training because it is the largest organ in the body, and chronic liver disease is common in every part of the world, and it is often silent until advanced. And imaging, particularly with the use of MRI, it provides a way to detect pathology early. You can even quantify it and also monitor it non invasively. So that's what made me very interested in liver imaging. And at the same time, the liver is a very biologically complex organ, and imaging gives us a unique opportunity for to study its microstructural, vascular, and biochemical changes. And that fascinates me because we can look at many things in the liver and that gives you meaningful clinical information. And that's what keeps me focused in liver research.
Yeah, that's very interesting. So, how did your early training experience from India to Singapore to Mayo Clinic shape your approach to diagnosing liver disease? I have seen that it's a very diverse journey. So, would you mind to share about your training experience?
Yeah, thank you. Yeah, it's a fascinating journey for me as well. And as you might be aware, in India, we have very limited access to advanced scanners. So every exam we do was very intentional, and you had to know exactly what problem you were trying to solve. So it was more like problem solving rather than trying to detect anything earlier. And at the same time, high disease prevalence demanded efficiency and pattern recognition. So we were all trained in radiology in India to recognize the pattern very early and be very specific about it. And we had very limited access to the advanced technology. However, when I moved to Singapore to do a fellowship, imaging was much more accessible to the general population. So That's when the screening and early detection became possible to be applied to the population. And it actually opened my mind to the value of preventive imaging, doing screening. Although the research opportunities in Singapore were somewhat limited because of focus on treating patients. But however, in Singapore at the same time, I was improving my MRI knowledge, MRI physics, and also the use of hepatobiliary contrast agents. That's when I came across first time. And when I moved to US, I've only worked in Mayo Clinic, so my experience is limited to Mayo Clinic at Rochester, Minnesota. There was a big emphasis on multidisciplinary care. There was a big need for imaging to be very quantitative, reproducible, and clinically actionable, which is very much I like because something we do in radiology which is clinically actionable. And this diversity actually shaped the first principle to use imaging to extract information that changes management and not just reporting descriptive reports. So the journey has been very fascinating for me as well, from very focused problem solving technique to screening to be more on a multidisciplinary care.
Yeah, Dr. Venkatesh, that's a very inspiring journey. So I also work with you. So I know that the magnetic resonance elastography has been central to your work. Could you just explain how this technique is changing the way we diagnose and the stage liver fibrosis and what it means for the patients who previously faced painful biopsies?
Thank you for the question again. I should say I've been very fortunate to have the opportunity to work with probably one of the greatest innovation in imaging and particularly applicable to abdominal imaging. The core idea behind magnetic resonance elastography is very simple. Fibrosis increases tissue stiffness, and this stiffness can be measured with mechanical waves and it can be encoded on an MRI scanner. So it basically transforms a subjective and a very histological estimate into a quantitative biomarker. This means that we can detect the fibrosis earlier, you can risk stratify better, and also able to monitor disease progression. And this replaces the previous gold standard, which used to be the liver biopsy, which was done with a needle percutaneously or intraoperatively and take a tiny piece of liver with the needle. And it used to cause a lot of anxiety to the patient, also causes pain. But at the same time, it suffered from sampling error and it made it less reproducible according across pathologists. But with elastography techniques, particularly MR elastography, it is much easier, safer, and simple, and are much more accurate to do the diagnosis and staging of liver biopsy.
And your research spans conditions from fatty liver disease to hepatocellular carcinoma. How do you see imaging evolving to detect liver cancers earlier and improve patients' outcomes?
Hepatocellular carcinomas is the most common liver cancer, primary liver cancer, and it typically develops in the background of chronic liver disease. And the risk of developing HCC increases with increasing fibrosis burden. So the highest risk is in the cirrhotic liver. But however, with metabolic syndrome associated steatotic liver disease or MASLD and previously known as NAFLD, we're actually seeing HCCs developing even before the cirrhotic changes has occurred in the liver. So we need to detect earlier HCCs in these non-cirrhotic patients. Traditionally speaking, we used to look for changes how tumor looks or how it takes up contrast, and this is like an advanced stage of advanced liver tumors. But now the future is about finding earlier clues like maybe there is a subtle change in tissue stiffness with elastography. There is certain increase in blood flow or even tiny shifts in water movement with diffusion imaging, etc. So early stage HCCs now has become more like a problem of detection even before vascular changes occur. This can be done using multi-parametric quantification like elastography, diffusion, and molecular targeted contrast agents. So that's what I see that in the future, image will actually evolve to detect liver cancers earlier, even before it becomes visible with vascular changes. But these subtle changes may not be easily appreciable by the radiologist with a naked eye, and we might need the help of augmented intelligence, machine learning, deep learning to do this kind of early detection. And we can add to what we know already in these changes. So In the future, I think it will be more like a multi-parametric quantification with involvement of some kind of augmented intelligence to help detect early liver cancers.
So, yeah, like the primary sclerotic cholangitis and cholangiocarcinoma present a significant diagnostic challenges. What imaging advances are you most excited about that could improve early detection and outcome for the patients with these biliary tract conditions?
Primary sclerosing cholangitis, as you mentioned, it is a very significant diagnostic challenge because it is mimics many other diseases and it is a diagnosis of exclusion. So we have to exclude a lot of things clinically as well as in the imaging to make a diagnosis of PSC. And PSC and cholangiocarcinoma actually sit at the intersection of inflammation, fibrosis, and developing cancer. So we are very challenged. It's a very challenging area to distinguish benign fibrosis and inflammation versus a developing cancer. So the advances in MR cholangography with a higher resolution actually has helped us detect early biliary ductal dilatation. Diffusion-based markers has increased, and even functional imaging may be useful and it is promising. Even we are applying MRA derived shear stiffness, which may provide early indicators of malignant transformation. But at the same time, as I mentioned earlier for the previous question, the most impactful development will combine from combining multiple parameters into a single risk score, as well as the use of artificial intelligence, deep learning, which you already know about it, that we have applied deep learning techniques to detect the cholangiocarcinomas even when they look like benign biliary disease and often missed by even experienced radiologists. So I think the biggest gain will come from advanced techniques is by combining all these parameters as well as using AI to help us detect early changes which can suggest the development of cholangiocarcinoma. It's evolving, but we are definitely moving in the right direction.
So, what advice would you give to radiology resident and young fellows who wants to make an impact in oncologic imaging research?
Thanks, Yash. And this is something more like a philosophical questions. Still, I would answer. My advice would be to focus on real problems or unanswered questions, because nowadays everybody is interested in AI derived projects because AI makes kind of has become the trendy. But AI is not always the answer for everything. But the use of AI in a specific process of the disease or a specific aspect of the disease is what going to make a difference. I would also say learn the basics, like understand the disease very well, understand the technology behind what you're working with, and be strong in that because that makes a very strong basis for making a impactful imaging research. At the same time, you need to work with people outside radiology, like for example, an oncologist, hepatologist. In my case, I work with them, I collaborate with them because they always get talking to them stimulates me and gives me ideas what needs to be done and what is technically required. I also suggest choose your projects very carefully that actually helps patients because that makes the impact, not the one which may publishes and never makes a clinical impact. So you should be making something like which is measurable, reproducible, and very clinically relevant projects. And for that reason, I actually like translational research that makes the most impact to the patient. So I would advise that if I can advise to all the young people, residents and fellows there to choose projects that genuinely help patients and makes a clinical impact and thereby you can make an impact.
No, I totally agree. So, finally, do you have any personal messages that you would like to share with the radiology imaging cancer community about the future of cancer imaging or the importance of collaboration across the subspecialties?
Thank you again, Yash, for that question. Yes, I think there is definitely a shift because now I think the cancer imaging is now shifting from simply finding tumors to understanding the biology behind them because we want to treat them and detect them earlier. And that is actually a big shift and it requires multidisciplinary collaboration, including radiologists, oncologists, MR physicists, data scientists like yourself to work together because no single specialty owns the problem of the cancer. It's everybody's problem in the clinical practice. And we need to be open to new technologies, committed to like doing very good scientific rigor And therefore, with these things and the input from everybody, imaging will move from just being a passive observation to an active contribution. So I would say that the future would belong to quantitative and harmonized and very highly clinically integrated imaging. And that gives information about precision of diagnosis as well as informs about therapy. And we'll be moving towards more like personalized medicine. So we need to stay evidence based and collaborative, and imaging can definitely play a major role in catching cancer earlier and also guiding better treatments.
Thanks for spending time with us today. Special thanks to our guest, Dr. Venkatesh, for his valuable insights. If you are enjoying the conversation, please rate, review, and subscribe wherever you are listening. Your interactions help more listeners find the show. Check out Radiology Imaging Cancer. Link to the journal will be the show notes. And today you heard from our team. Special thanks to our editor, Callie Myers. We will see you next time on Radiology Imaging Cancer podcast.